Sure. So being on a PKU diet is a considerable stressor for adolescents. Adolescence is a time of increasing independence, and so they want to have more freedom to be outside the home, to spend time with the peer group, and eating is a big part of socializing. So if someone were able to discontinue medical food, which means formula and the low protein special foods in their diet, it can remove a tremendous burden. So, for example, one of our patients might be prescribed to be able to take 5 grams of intact protein in 24 hours. And so to go from that to being able to eat anything they choose is really a dramatic difference. So 5 grams of protein might be what's in one slice of bread. So these children, adolescents are eating these special customized processed food substitutes and sometimes complain about not feeling full after a meal. So being able to get in during the time of rapid growth and the growth spurt and allowing them to eat more natural food and to have more choice in food is really big for them. Also, we see in adolescents that adherence to the diet often worsens naturally because of their increased independence, in which case they have a higher amount of phenylalanine in their blood and therefore in their brain. And so this exerts toxicity to neurons. It alters neurotransmission. And so this leads to adverse effects on their cognition and mental health. So that was a direct observation from my clinic patients. Basically, the drug had previously been approved for age 18 and up, and until these new FDA guidelines. And so 18 is when they're in their senior year of high school or their first year of college. And these are years of tremendous change and stress and many activities and events. And so in my clinic, I saw that that was like the worst time to start it because they were just busy and stressed. And I'm doing a telemedicine visit and they're trying to get ready for prom. And it was just really difficult balancing all of those things with starting Pegvili's. The reason for that is because it takes time to tolerate it because of the immune response. And so they're dealing not only with the injections, but with the side effects and frequent medical visits. So when my center and some other centers tried Pegvili's in younger children, we did find a dramatically higher success rate just adhering to the treatment, sticking with it when they were younger and they had the family support and not so many changes in their lives happening. Um, it's a good question. This medicine can be unpredictable when we're going to see the drop, but when we do see the drop in blood phenylalanine, it can be dramatic and sudden. And so sometimes when there is a rapid drop in Phe, people can feel unusual or even poor at that moment, but then we'll acclimate over the next few days or the next week or two. And then they tell us that they feel much better than they did before. We have had people that describe improvements right away, sometimes using the wording clearing of the fog related to the brain fog that's experienced by people with high phenylalanine levels. And people also describe improvements in executive function and attention deficits. And those things and their improved focus, they might notice right away. That may actually be the first clue that their Phe has dropped from the treatment. So frequent communication and frequent visits, the use of telemedicine can be really helpful for check-ins. Um, that makes a big difference, just us knowing what's happening with them. And the reason for that is because we know how to manage most of the side effects that they have. So if we can promptly manage their side effects, then that can make the difference between continuing treatment and getting to efficacy or them giving up prematurely. So in my practice, I don't want to make things harder for them in their lives. I don't want them to miss that hockey game or that family trip. So we act right away with dose adjustments and sometimes with concomitant medications to treat the side effects to help them to feel well and to minimize the impact on their lives of the side effects. So the side effects usually go away or get much better over time. And so just helping them to get through that early stage of induction and titration, um, and having that process be more gentle, even sometimes slowing it down, can be helpful. They're also on pre-medications that can help to reduce the potential side effects, but will probably not avoid them altogether. So as I mentioned, diet alone becomes much harder through adolescence. There are other therapies called cofactor therapies that can help to treat many patients along with diet, but infrequently do they allow for lifting of all dietary restrictions and formula. And the ones that it does help have milder genotypes. So the fact that this one is genotype independent means that no matter how severe someone's PKU is, they could have severe classic PKU and have no enzyme activity, not be helped by any other medications, and respond to this one. So that is really important and something that is special and extremely helpful for this treatment because it gives a whole other group of individuals with PKU the opportunity to try to live a better life, eat a better, more natural diet, and have more freedom as a result.